Hello everyone, welcome to my channel. I'm here to help you with your nursing studies. Diabetes mellitus is a chronic metabolic disorder. It is characterized by persistent high blood sugar. This happens when the pancreas cannot produce enough insulin, or when the body's cells do not respond properly to insulin. Type 1 diabetes is caused by autoimmune destruction of pancreatic beta cells, leading to little or no insulin production. It is usually diagnosed in children and adolescents. The onset is abrupt and may present with diabetic ketoacidosis, or DKA. In short, type 1 diabetes is autoimmune, causes little or no insulin, affects children, and has abrupt onset. Now let's learn about type 2 diabetes and other types. Type 2 diabetes occurs due to insulin resistance and relative insulin deficiency.
It is more common in adults and increasingly seen in obese adolescents.
Other types of diabetes include gestational diabetes, MODY, and secondary diabetes due to medications or pancreatitis. Let's learn the common signs and symptoms of diabetes mellitus. Polyuria means frequent urination, a classic symptom of diabetes. Polyphagia is increased hunger due to cellular starvation. Weight loss, especially in type 1 diabetes, and fatigue are common symptoms. Blurred vision and slow healing of wounds are signs of prolonged high blood sugar. In type 1 diabetes, emergency signs like nausea, vomiting, and diabetic irascibresis or DKA.
Let's understand the pathophysiology of diabetes in simple terms.
When insulin is deficient or cells are resistant, glucose cannot enter the cells, causing high blood sugar or hyperglycemia. High glucose leads to osmotic diuresis, causing frequent urination, dehydration, and excessive thirst. Cells starve for energy, leading to increased hunger and weight loss.
Fat metabolism produces ketones, increasing the risk of diabetic ketoacidosis in type 1 diabetes. Prolonged high blood sugar can damage blood vessels, nerves, kidneys, and eyes.
Let's explore nursing management for patients with diabetes mellitus. Nurses start with assessment, monitoring blood glucose, vital signs, signs of hypo or patient education is key. Teach importance of diet, exercise, glucose monitoring, and recognizing early warning signs. Administer medications, insulin therapy for type 1, and oral hypoglycemics for type 2 diabetes.
Provide emotional support and encourage adherence to the treatment plan.
Now let's look at the medical management of diabetes mellitus. Type 1 diabetes is managed with insulin therapy, either basal bolus, multiple daily injections, or an insulin pump. Type 2 diabetes is managed initially with lifestyle modifications, a healthy diet, weight control, and regular exercise. Oral medications such as metformin, sulfonylureas may be used. Diabetic ketoacidosis or DKA is treated with IV fluids, insulin infusion, and electrolyte replacement. Thanks for watching the Nursing Diary channel. Don't forget to like and subscribe.